Peter Dutton was front and centre and was the health minister, and was so bad, doctors voted him the worst health minister in their history, the AMA, and indeed Tony Abbott sacked him.
When I was health minister, bulk billing rates were 84%, and they're now at 77%. Everything this Prime Minister touches turns to disaster.
If you ever want to upset Peter Dutton, wave this in his face. It's like garlic at a vampire, because he hates Medicare.
So you will have heard that Medicare is at the centre of Labor's election pitch, and its $8.5 billion promised spend on bulk billing incentives has been matched by the coalition. But what does this really mean for everybody? Does it mean that everybody will be bulk billed? Will it be easier to be bulk billed for everyone? Well, the answer to that is yes and no, depending perhaps on where you live and what sort of healthcare you actually need. The average out-of-pocket cost across the country is at about $46, meaning that the average person pays about $90 for an ordinary consultation with a GP. Bulk billing has declined very rapidly in the last 5 years. It has increased lately with the bulk billing incentive, which was tripled under Labor 2 years ago, bringing the rate to about 77.5% of all consultations that are bulk billed. Now that might sound high to you, but the reality is that for most people it is a lot lower than that, in the order of about 48%, while something like only 26% of people are usually bulk billed. The aim of the federal government policy is to further incentivise bulk billing, and the bulk billing incentive introduced 2 years ago, which only applied to pensioners and anyone with a healthcare card, will be extended across the population. That means GPs will get extra lump of money for everybody that they bulk bill, and GP practices who bulk bill everybody in their practice will get an additional 12.5% chunk of money from the government.
$8.5 billion commitment to deliver stronger Medicare everywhere, saving people hundreds of dollars in out-of-pocket costs. No asterisk, no fine print, no terms and conditions, just 100% bulk billing covered by Medicare.
Now that doesn't mean that gap fees will necessarily lower, because for those people who aren't bulk billed because the GP actually doesn't utilise the incentive, they will simply face the same out-of-pocket costs. With bulk billing, GPs can't charge you a gap fee if they bulk bill your consultation. So if you are not bulk billed and charged a gap fee, this policy will not apply for you. And some of the reasons that GPs might not take it up include that they will ultimately be worse off in terms of money in the hand if they do utilise this incentive. There'll be about an average $20 difference between what a GP would get if they actually charge you a gap fee, whereas if they utilise this bulk billing incentive. So for GP practices who don't see the value in this for their bottom line or for the type of healthcare that they provide, in that they might be more involved in complex care, longer consultations and those sorts of things, may decide that this GP bulk billing incentive simply isn't worth their while and not utilise it. And if that happens, people who are not bulk billed will simply be in the same position that they are today. There's little doubt that this policy will increase the rate of bulk billing across the country. It will be easier to find a bulk billing practice, and it'll potentially be easier to be bulk billed by your GP, but it certainly won't apply to everyone. And at the end of the day, we're still left with this intractable problem in Australia. GP practices have faced incredible rising costs in the past 7 or 8 years, to the point that they have to charge these gap fees in many instances just to stay afloat.
Coalition government is committed to $9 billion worth of investment into our general practice network. It will provide support to training, it will provide support to mental health services, and it will provide support to making sure that practices are viable and can provide a mix of services to patients, and it'll help build those bulk billing rates back up to what they were under a coalition government.
The best case scenario of this policy is that it will actually increase that incentive to bulk bill the people who can least afford to pay, and that will be one good thing. But in terms of universal benefit, it's not likely to apply across the board, and those people struggling with those very high out-of-pocket costs for seeing their GP, for some of those people it will be situation normal.